Hello, it's Friday, April 29th, 2022. It's Dr. Rhonda Johnson, and today I'm discussing heart issues after COVID-19 infection. Now, we already know that long COVID is a collection of more than 200 different symptoms, and different SARS-CoV-2 variants have affected the body in different ways. So as the variants keep changing, the picture of long COVID keeps changing. But one thing we know is that long COVID can include a list of heart problems. So today I'm discussing a recent study by Dr. Zayed Al-Ali, who's chief researcher at Veterans Affairs in St. Louis Healthcare System. He has published a body of work on COVID's effects on the heart and mental health. But today I'm talking about the heart. So his research team looked at what happened to people's hearts 6 months to a year after they had COVID. What's interesting that he looked at only people who had mild disease, who did not need hospitalization or ICU care. Now, folks, their major finding was that adults with COVID-19 have a higher risk of all sorts of heart problems between 6 months and a year after COVID. Their study period did not include after a year. And these heart issues included arrhythmias, which are irregular heartbeats, or the heart can beat too fast or too slow. Atrial fibrillation, which is a fast heart rhythm in a particular pattern. And they also found an increased risk of stroke, of blood clots in the legs, and blood clots in the lung, and of heart failure and heart attacks. Folks, this is serious stuff. Now, these heart issues occurred even in people who did not have any heart disease to start with, who were athletic, who didn't have a high BMI, who weren't overweight, obese, who didn't smoke, who didn't have diabetes or kidney disease. And so they concluded that COVID affected adults who were previously healthy and had no risk factors or problems with their heart. And again, the people who had got COVID and had this heart stuff going on, they had COVID that was so mild that they were able to be cared for at home, didn't go to the doctor, but they still developed an increased risk of heart problems. So what's causing this? Now, there have been so many studies, even autopsy studies, that suggest multiple pathways, from an immune and inflammatory response to when the virus invades the heart muscle cells, or it could be from the fact that the COVID virus attacks the endothelial cells that line the vessels of the heart. So the bottom line, folks, is that it's important to have a relationship with your doctor before, during, and after COVID. Talk to your doctor, please, and see if you should have a heart checkup if you've had COVID. That's my message today. Be careful.